Part 3 of this presentation describes the logical data structures that support the assessment of the damage caused by a particular stroke. The logical data structures that support the assessment of the damage caused by a particular stroke are shaded in red in this diagram. These data objects will be described in the next 3 slides. First, we have the data object class called person. These data objects represent the existence of real people who play various roles in the stroke rehabilitation industry. This includes people who are stroke survivors, carers of stroke survivors, or specialist stroke therapists or primary health care professionals. In the Stroke Rehab app, we are particularly interested in people who are stroke survivors and what environmental factors they will have to cope with when they are discharged back into their communities, and how these environmental factors may affect the effectiveness of community-based therapy programs. So this knowledge can be expressed in the form of person environmental factor data objects and the following natural language sentence pair. A person may experience many environmental factors, and an environmental factor may be experienced by many people. These person environmental factor objects need to be recorded in the central database before the stroke survivor is discharged from hospital, so that knowledge about significant environmental factors affecting a particular stroke survivor or carer can be made available to community-based therapists who may prescribe therapies in the future. Next, we have the data object classes called stroke episode and stroke event. Each stroke episode data object represents the fact that a person has suffered a stroke and was admitted to an acute care hospital. And of course, a person may suffer more than one stroke during his or her lifetime. This fact is expressed in the following natural language sentence pair. A person may suffer many stroke episodes, and a stroke episode must be suffered by one person. Now, when a person is admitted to an acute care hospital with symptoms of a stroke, a series of tests must be carried out quickly to confirm and characterise the stroke episode and to commence appropriate emergency treatments. These tests may conclude that the stroke episode is either an ischemic or hemorrhagic stroke and may create a number of diagnostic images, including CT scans or MRIs. But a single stroke episode may be caused by multiple stroke events, which may themselves be ischemias or hemorrhages. And each of these ischemias or hemorrhages may occur in different brain structures and cause a different set of disabilities. So each ischemia or hemorrhage must be represented as a separate stroke event object. These facts are expressed in the following natural language sentence pair. A stroke episode may involve many stroke events, and a stroke event must be involved in one stroke episode. These stroke episode and stroke event objects need to be identified by the neurologist soon after the stroke patient presents to the emergency ward of an acute care hospital and loaded into the central database of the Stroke Rehab app before community-based stroke rehabilitation commences, so that community-based therapists and clinicians have a full appreciation of the root causes of the stroke survivor's disabilities. During the course of neurological investigations, it should be possible to identify the brain structures and brain functions affected by each stroke event. And because each ischemia or hemorrhage may affect a different brain structure, each stroke event may affect one or more elements in the brain functional map described earlier. So one task of neurologists in an acute care setting is to determine which brain structures have been damaged and which brain functions have been affected by each ischemia or hemorrhage associated with a particular stroke episode. These facts can be recorded in data objects belonging to the Stroke Event Functional Map object class and are expressed in the following natural language sentence pair. A stroke event may affect many brain functional map elements, and a brain functional map element may be affected by many stroke events. These stroke event functional map objects characterise the structural and functional damage caused by a particular ischemia or hemorrhage and should be loaded into the central database of the Stroke Rehab app before community-based stroke rehabilitation commences. They will be very useful in later analysis of the effectiveness of various therapies on strokes that cause damage to particular areas of the brain. To summarise this section of the stroke assessment data object classes, we have seen how these data object classes represent the knowledge of acute care neurologists and clinicians about individual stroke survivors, the current and previous stroke episodes that caused them to be admitted to an acute care hospital, the separate stroke events, including ischemias and hemorrhages, that contributed to these stroke episodes, and the brain structures and brain functions affected by each stroke event. This knowledge is not only important in determining appropriate acute care treatments, but also for planning suitable therapies in the subacute or community setting.